As parents age, caregiving frequently becomes an unplanned reality. How do we handle the final chapters of caregiving and the anxiety that may accompany it?
We will discuss this and more today on Real Family Talk. Welcome to Real Family Talk. In today's episode, we're talking about the final chapter of caregiving.
Joining us today is experienced caregiver Dawn Venn, and in our second and third segments, licensed clinical marriage and family therapist Dr. Maya Thomas will join us. Dawn, thank you for being with us today.
Thank you for having me.
And thank you for coming back.
Yeah.
Of course, what we know is that about 63 million Americans are caregivers. That means 1 in 4 Americans are caregiving in their homes. Now, this is really interesting because between the ages of 45, most caregivers are between the ages of 45 and 64 and are women, most of them. And you fit right in to this bracket.
I do.
Of course, on the lower end. So, of course, what that means is that you are part of what we would call the sandwich generation.
Yes.
Tell us a little bit about what that means.
Yes. Well, when my mom was 89 and she had an accident in her apartment, and then she was in the hospital and rehab, and then she came to live with us. So, it was an adjustment into our already busy lives, as most people have. With 2 kids in college, working full time, and now having my mom join us and needing care. So it was quite an adjustment.
Yeah, and the sandwich generation means you're taking care of your mom and you're also dealing with still having children at home.
Yeah, because they need our support, they need our attention, they need our finances.
So, yeah, you cared for your elderly mother for 6 years. And of course, recently she turned 95 years of age, and all that celebration and stuff.
Yes.
Tell us what happened during that time.
Well, we had big plans to take her to her favorite restaurant to have her favorite foods, which is onion rings and root beer floats. And
that's an interesting combination.
Yes.
It sounds wonderful.
That's all she wanted. And so our family was going to take her, but then 2 days before her birthday, I walked in to greet her and help her with her morning routine, and she was not doing well. I mean, just overnight, she was fine, and then she wasn't fine. She was confused, she was weak, she disorientated and scared. I could see she was scared, and which we had come to learn that are often signs of a UTI, a urinary tract infection. And so then I'm like, Mom, we're going to have to go to the hospital. And she's like, no, I don't want to go to the hospital ever again. I'm like, but you need care, so how can I do that? And like having conversations with, family and our pastor and a social worker led us to signing her up for hospice care on her birthday.
So that must have been pretty difficult.
Yeah.
It was difficult.
Yeah. How were your final days of caregiving, and did you feel that you were ready to handle this part of life?
Well, we thought we were going to be ready, because we had seen others going down this path, and we're like, well, we're not going to let that happen. We're going to have things in order. And, we had many things in order, and we had the opportunity to, talk with Mom about, her wishes for the end of care, what she wanted, and to help, prepare ourselves and her.
Right.
So she was definitely a part of it. She was sharp, her mind was good, and so she had a lot of opinions about it. And it helped guide us because it's easier to follow someone else's plan than to come up with a plan for someone else.
But
So-
sometimes that's hard because as a caregiver and a loved one, you want this person to go on longer. Even if it's a burden, to take care of them, you still love them. So did you feel in some ways that if you gave into her plans that you were giving up or that you were defeated?
Yeah, it because we were hopeful, like she's going to bounce back, but this time, with every sickness, it was a new normal, a little bit lower, her health wise and her abilities, and so this time it just was, she was not bouncing back.
Right.
And then thinking about calling hospice, even though my mind was telling me, hospice is a good thing. They're there to help you. It doesn't mean it's the end. It doesn't mean that. But it felt like it. And I felt defeated as a caregiver. But yet, this was how we could honor her and to have her stay at home, not go to the hospital, not call 911 again, and to have her surrounded by us.
Yeah.
And that's what she wanted.
So I'm hearing you say that most important at this stage is that we keep them comfortable.
Yes.
And that they are stable, because just being there without any care certainly is not an option.
Right.
And you want to do right by them.
And also honoring,
Yes, her
honoring
wishes.
her wishes.
Yeah.
I think that's what's most critical that has come out of what you're sharing, is that as difficult as it is for us, the caregiver, the loved ones, that we honor the wishes of the person who's in this situation.
Yeah.
And did you feel that your mom felt good about what you did and the decisions that you made?
She did. And she would tell me every day, I am so thankful for you. I'm so thankful that I have a daughter.
Because you have 3 older brothers, right?
Yes. She's thankful for them, but
She's thankful.
but she would definitely.
But before we wrap up, you also had the opportunity to plan a service for your mom. Tell us briefly how that was and what that did for you.
Well, it was, my mom said, well, because we say, what do you want for your service? Well, I'm going to be dead, so it's up to you. But we included her favorite hymns and Bible verses and just a joyful celebration of life that I think, she would have loved.
Yeah.
It's time for us to take a short break, but when we return, we'll continue talking with Dawn and Dr. Maya Thomas on the final chapter of caregiving. Stay with us.
Today on Real Family Talk, we are talking with Dawn Venn, an experienced caregiver and licensed clinical marriage and family therapist, Dr. Maya Thomas, on caregiving and its final chapters.
Let's talk about caregiver fatigue. The average family caregiver spends about 25 hours per week on caregiving activities, with some providing over 40 hours. Many caregivers provide help with errands, housework, or financial support rather than personal care. Dr. Thomas, let's talk about caregiver fatigue. Tell us about that. What does it mean and what does it look like?
I'm so glad we're talking about this because it is incredibly common. Caregiver fatigue, I will tell you, in all my 15 years of working with clients and patients, I have never met a caregiver who at one point or another has not experienced caregiver fatigue. And the one big marker of caregiver fatigue is a sense of weight, of heaviness, and low motivation to caregive. Because if you're caregiving, especially as a family member, you care about your person. You really care about your person. And when that sense of wanting to do for them and looking out for them starts to diminish because you're so tired, whether it's emotionally, mentally, or physically, that's a big indicator that we're starting to head into some caregiver fatigue.
And it sounds like there might be some guilt that might come along with that, which probably is even more burdensome.
Yes, the mental load of a caregiver, and Dawn can speak to this beautifully, I'm sure, but the mental load, sometimes more than anything else, can be really heavy.
Yeah.
Well, here's a good segue to ask Dawn, as a caregiver, did you experience caregiving fatigue, and what did it look like for you?
I definitely did, although you don't really realize it maybe till after and you look back. But just like what Maya mentioned, you know, that fatigue, just being tired and being that feeling of being overwhelmed. And then, you know, people would say, hey, there's this great place that has resources and you should sign up for this. And I'm like, can you do that for me and just bring me the resources? You know, like you just don't have any more energy. Yeah.
Yeah, so that leads us to the whole notion of the team, of having a team. Why is a team important? Because, I mean, she's saying people are offering resources, but are you going to do it for me? Because I have nothing left to give.
I think we like to think that we can do everything and that we have enough time in the day to do everything and we're going to be the best, most loving person and caregiver. And I think sometimes it's hard for us to admit vulnerability and for us to admit that we cannot do it on our own, nor should we, nor did God create us to do it on our own. We are created in community, in family with each other. So a team is vitally important for a caregiver, like water, like food, like sleep. A team is vitally important.
You know, what it sounds like to me is what Proverbs says, you know, two are better than one. You know, when you're by yourself, you can burn out very quickly and you can lose hope. But if there's someone else to cheer you on, to give you a helping hand, you know, as a team, you do much better and are able to provide the services for your loved one that they really need. Yeah.
So who made up your team?
Well, I'm so thankful for my husband and that he saw, you know, the load, and he's like, we cannot do this alone. Like, you can't do this alone, we can't do this alone. So he started Team Maryland. And so first it started with our family of 4 and then expanded as mom needed more care. We had a CNA come join us and was
Tell
there.
us what that is, just in case someone doesn't know what a CNA is.
Yes, a certified nursing assistant.
Yes.
Yes. So, and Melanie was an amazing blessing to our family. She would be there during the days while we were at work and was just gave us the peace of mind that mom was taken care of when she needed help. And then, you know, church members helped, our extended family helped. So we just kept building Team Maryland until we had hospice join Team Maryland.
So Team Maryland was really a thing, wasn't it?
It was.
And it was dynamic, it sounds like.
We should have made banners.
And your kids, you also, I believe, pulled your children
Definitely.
into helping.
Yes.
Your college age and then young
Yes.
adult children who were
Yes.
also working professionals at the end of this journey.
Yes, and our son is a nurse, and when he had moved out of the house, but he would stop by to check on Grandma. And he saw how tired I was. He's like, Mom, let me take care of Grandma. Let me change her. Let me take care of her needs. You just go rest.
That's beautiful. So Dr. Thomas, for Dawn, she was able to take this advice and pull other people in. For people who are having difficulty, what do you say to them so that they can continue caregiving and mitigate the fatigue?
Yeah. You know, we got to figure out why we don't ask for help. It's really important to figure out why. And sometimes, I'm going to use the word savior complex. Sometimes we think that feeling that we feel, the I did it feeling and I did it all by myself feeling, sometimes can come over us. So Dawn was able to navigate that complex and make sure that it didn't become something that she was fighting with, because then it becomes about me and not about what we need as a family, what the person needs. So really discovering what that's about. And it's not an easy thing. You don't even realize you're doing it because it just feels good to help. But then it can become a little bit of an issue when you're just burned out.
So you're almost suggesting that the caregiver may need counseling themselves.
Yeah.
And speaking as the caregiver, how hard it is because you're so invested, and I got so protective of my mom that it was hard to allow Team Maryland to exist. But our immediate family, and like Hannah our daughter would be cooking meals and she would clean up after grandma. I mean, we couldn't have done it without our
So it sounds like it was really a combined effort, what would I call it? A shared vision
Yes.
on Team Maryland to
Yes.
make sure that she was comfortable,
Yeah.
to make sure that she was cared for, to make sure that whatever she needed was provided for her. And not by one individual, but by a team of individuals, so that when you were going down, someone just took the baton and ran with it. It's a relay. It's a relay run.
Yeah, Dr. Thomas.
I just want to add, Don, it's not easy to pass the baton because it's a vulnerable thing. Are they going to caregive as much as me? Are they going to do, and that's where it's a good thing to care, but it can slip into that savior complex when you're like, no one can do it as good as me, as well as me. So it's a sense of vulnerability to pass on a precious family member to someone else. And it takes a lot of courage to do that, and I think that's fantastic.
Good point. Excellent point. When we return, we will continue talking with Dr. Maya Thomas and Don Venn. Stay with us.
We're back on Real Family Talk with Don Venn, an experienced caregiver and licensed clinical marriage and family therapist, Dr. Maya Thomas. We're discussing caregiving and its final chapters.
And now we want to talk about hospice care, because hospice care is generally offered during the last stages of a person's life, where the focus on making sure the person is comfortable as their life draws to a close. Deciding when introducing this kind of care is important for a caregiver. Very important. So from your perspective, Dr. Thomas, when is the appropriate time to make that decision about hospice?
That's a good question. I do want to clarify, sometimes there's confusion about palliative care versus hospice care, because those are two different things.
Yes.
But they overlap. There's an overlap for them. Palliative care is a focus on quality of life, and you don't need to be terminally ill to ask for palliative care. So if there is an illness that has a very aggressive treatment that's going to really diminish the quality of life, then asking your doctor, hey, can we talk to a palliative care specialist to decide, do we want this treatment? That could be something that you can do. Now, hospice is under palliative care because hospice is usually reserved for when you have about 6 months left to live, but it doesn't have to be. It can be more than 6 months. Usually, though, they come in for those last few months to help with quality of life, with making sure it's not about treatment. Palliative care, you can have treatment and hospice care.
Okay, that's a good distinction.
Yeah.
I just want to follow up with a question on, so what makes a distinction? Because I've watched the news, I've seen important figures in our country, and they say, this person has been in hospice for over a year.
Yes.
Is that really hospice, or is it palliative care?
It can be hospice.
Okay.
So you call for hospice when you think there's about 6 months left.
Okay.
But we don't know we don't know the time or day.
They're not God.
Right.
We don't know.
Yes.
So it could be that they live longer, and it could be that hospice care being called in to do comfort care, quality of life, to really surround the family, makes them live longer than you think that they would.
Yeah.
So they could be in hospice care for a while. The difference is they're not receiving curative treatment. It's
Okay.
just quality of life comfort care.
Right, right. So Don, when you called hospice, you pretty much sensed that this was it. You saw that your mom was really declining. And so tell us a little bit more. I know you spoke with us a little bit earlier about it, but tell us what that process was like and how it went for your mom.
Her health to continue to decline. And, the hospice nurse would come each week checking on her. But, you're absolutely right that it's just for comfort care. And they would remind me time and time again, your mom is in the driver's seat. She determines what care she's going to receive, you know. And they also told me, hey, if she gets better, you can take her off hospice care, no problem, and then she can go back on. It's not a problem. So that was nice to know. But having her on hospice and that assurance, that comfort, that assurance that I could call 24/7, that line, you know, I didn't have to think, oh, do I call 911? I just call the hospice number and they answer, and then they can walk me through what needs to be done next. So that was empowering, I guess, and it made it okay that we kept her home.
Right. So it seems to me that more people need to really avail themselves of this, because that alleviates, I think, so much of the worry and the concern, because now you have a 24/7 hotline where someone is available to you. What's the advice that we give to families? This is just such a difficult time for families. And I know this is your area and you've dealt with families with long-term illnesses. So you've seen it all. What is your best advice for families as to when to make that phone call?
I think Dawn's story captures it beautifully. It's when the patient or the care receiver says, I'm done. I just want to be peaceful, because let's be honest, a lot of medical interventions and procedures are a lot. They're painful, their recovery time. Not to say that we don't do it, and we do, but when the person has had enough, and when you're dealing with chronic illnesses over years and years, it's a lot of drain emotionally, physically. And when the person says, I've had enough, or when a caregiver can say, have you had enough?
Yes.
Maybe sometimes they need permission from the people around them to be able to stop and say, it's okay, I can, let me just rest now and enjoy the time that I have left.
You know, as you're speaking, I'm thinking about a good family friend. And in his last days, he basically said to his spouse, no more esoteric measures. This is the way he put it. You know, and he was a physician himself. He said, no more esoteric measures. I've had enough, and I'm ready to rest. So I think we should take cues from the patient, and as a part of that team, we should be also aware of their energy level and how much is enough, and understand that we don't need to push them to hang on. If a person's life has ran out and their health is declining, and it's very obvious that they're not going to recover, just allow them to rest. Allow them to rest, and bringing the professionals to help you manage this time. Now, there's a very important question that I wanted to ask Dawn, and that is, there's a lot of caregiver regret and second guessing. Did I do the right thing? And you know, people can torment themselves asking whether or not I've done the right thing. And I'd like to know, how did you handle those feelings? That voice in your head.
Yes, there's that voice there for sure, and definitely regrets. But I rest in the knowledge that I reflected what Mom wanted, you know, because when it was down to the last few days and she was having a hard time breathing, she had already stopped eating or drinking, and she was having trouble breathing. Her congestive heart failure was just taking a toll on her. And we didn't have the oxygen tank yet. You know, I called the hospice and it was coming, but, you know, wasn't there. I'm like, Mom, I can call 911. They'll come right away with oxygen. She looked at me and she said, don't you dare. I said, okay.
Still spunky to the very end.
Yes.
Still Mom.
yes. You know, so I'm like, okay, I regret it, but yet I know that's what she wanted. And the other thing I regret is like, complaining to her and, you know, about how noisy she was, and, you know, all the nights she would scuffle around in her wheelchair at 2 a.m. and we're trying to sleep, or the singing silly songs, but now the house is quiet. And I knew I would miss it. But
you did well. You honored your mom to the very end. Thanks so much, Dawn. Thank you, Dr. Thomas, for being with us.
The nearing of death is often shrouded in anxiety and fear. Yet as we walk with Jesus, he has promised there's nothing to fear. In John 14, 1 through 3, it says, "Let not your heart be troubled. You believe in God, believe also in me. In my Father's house are many mansions. If it were not so, I would have told you. So I go to prepare a place for you. And if I go and prepare a place for you, I will come again and receive you to myself, that where I am, there you may be also."
Thank you for watching Real Family Talk. Join us again when we'll share more about strengthening families and inspiring hope. See you next time.